Alright, Miss Audra, my name is Kara. I'm going to do a quick head-to-toe assessment on you. It's going to be completely confidential, okay? Okay. First, I'm going to begin with inspecting your head and face, inspect your skin for any lesions, any pustules, any sort of deformities, any excessive hair growth. Don't really see anything. Facial features seem to be symmetrical on both sides. Hairline is good, equal hair growth all the way around. Next, I'm going to go into palpating. Feel for any nodules or any sort of deformity. I don't really feel anything. Alright, next we are going to move in and check your temporal arteries. Alright, temporal arteries are present and same on both sides. Next we'll go ahead and check your TMJ. I can get you to open and close your jaw for me. One more time. Alright, no clicks or anything noted. Jaw opens without any difficulty. Next, we're going to check a few cranial nerves. I'm going to get you to clench your teeth real tight. And I'm going to try and pull on your jaw, but don't let me open your mouth. Alright, good. Next, I want you to close your eyes. And you let me know whenever you feel this cotton ball, okay? Alright, so she felt the cotton ball on both sides. Next, we will go ahead and move into some motor function. I want you to smile real big for me and frown and raise your eyebrows. Close your eyes real tight. Show me your teeth and puff out your cheeks for me. Perfect. Alright, next we're going to go ahead and move on to our eyes. So we'll check our visual acuity first with this smelling part. Alright, sweetheart, if you could cover one of your eyes and read the smallest line that you can read.
F-E-L-O-P-Z-D.
Okay, that is 20/20. And cover your other eye and do the same thing.
F-E-L-O-P-Z-D.
Alright, 20/20 as well. Alright, next we will check for extraocular movement. I want you to follow my finger with your eyes and your eyes only. Eyes are conjugate and both follow my finger without any sort of difficulty. Go ahead and take a quick look in there. Pupils are about a 4. Irises are green. Pupils are equal and reactive to light. Sclera is white. Conjunctiva is pink and moist. Alright, Miss Audra, I'm going to get you to focus on this light right here. And then when I tell you to, I get you to focus on something on that wall back there, okay? So focus on my light. And then focus on the wall. And the light. And the wall. Alright. Eyes are conjugate. Whenever looking at the pen light, her eyes focus inward and her pupils constrict, and when she focuses on the wall, her eyes move back out and her pupils do dilate. Let's see. Let's go ahead and move on to our ears. Go ahead and inspect and palpate our ears for any deformities. Ears hang on the face symmetrically on both sides. No overt deficits noted. Next, we're going to go ahead and move on to the whisper test. I'm going to close one of your ears and whisper a word, and I want you to repeat that word back to me, okay?
Apple. Baseball.
All right. Go ahead and move on to our nose. Inspect our nose. Nose looks to be midline and symmetrical. Go ahead and get you to close one side of your nose for me and breathe in. And the other side. Perfect. Then we are going to palpate our sinuses. Start with the frontal. Tell me if you feel any pain. Any pain?
No.
And then the maxillary. Any pain?
No.
Okay. Next we'll go ahead and move on to our mouth and throat. Get you to open your mouth for me. Tongue is pink and moist. Hard palate, it's pink and shiny. Gums are also pink and moist. All of her teeth appear to be intact and normal. You say "ah" for me? Uvula does move. Tonsils are present. Probably give them a rating of a 1. Alright, we'll go ahead and check for our gag reflex. Alright, gag reflex is present. Go ahead and stick out your tongue for me and move it side to side. Alright, tongue is symmetrical and has equal movements left and right. Next, we're going to go ahead and move on to our neck. I'm going to feel any of your lymph nodes, see if there's any swelling or firm lymph nodes. So we'll start with the preauricular. Just to feel for any abnormalities, any firm lymph nodes. Postauricular. And then we'll move back to the occipital. And the tonsillar. Submandibular. And submental. Not really feel any of our lymph nodes. Go ahead and go into the superficial cervical, posterior cervical, deep cervical, and the supraclavicular. And again, I don't really feel any of her lymph nodes, so no abnormalities there. Next, we're going to check range of motion. So I want you to tuck your chin to your chest, lean your head back, touch your ears to your shoulders, turn your head side to side. I want you to do that again, but against pressure. Alright, and shrug your shoulders against me pushing. Perfect. Alright, now we're going to move on to palpating your trachea. So, I'm going to feel over here. Trachea is soft and movable. Could you swallow for me? Your trachea does move when she swallows. Next, we'll move on to carotid pulses. Feel one on each side. On this side. Carotid pulses are 2+ and equal bilaterally. Next, we will listen for bruits. Alright, take a deep breath in and hold it. Alright, and this side. Deep breath in. Alright, no bruits are heard. Next, we'll go ahead and move on to your posterior chest. I'm going to get you to turn around for me, if you will. Go ahead and inspect and palpate our posterior chest, looking for any abnormalities. Her chest seems to be symmetrical. No lesions or anything like that noted. Just going to go ahead and feel for any sub-Q air. Don't feel any. So next we're going to go ahead and move on to tactile fremitus. So whenever you feel my palms on your back, I want you to say 99.
99, 99, 99, 99, 99.
Alright, vibrations are equal on both sides. Next we're going to percuss. Let me know if any of this hurts, okay? Alright, no pain there?
No.
Alright, next we're going to check for CVA tenderness. I'm going to do the same thing, and I want you to tell me if you feel any pain, okay? Alright, percussions on both sides sound the same. Next we will go ahead and move on to listening to breath sounds. So whenever you feel my stethoscope on your back, I want you to take a deep breath in for me, okay? last one. Alright, lung sounds are clear and equal bilaterally. Next, I'm going to get you to turn around for me. We're going to inspect and palpate her upper extremities, looking for any deformities or abnormalities. Both arms appear to be symmetrical, no obvious deformities noted. Don't feel anything. Next, we are going to check our pulses. So start with the radial pulses. Got 2 plus radial pulses equal on both sides. Move to the ulnar. Both ulnar pulses are 2 plus and equal bilaterally as well. And we'll move into for our brachial. Brachial pulses as well are 2 plus and equal bilaterally. Next, we will move on to calf refill. So let me see your hands real quick. I'm just going to squeeze on your fingernails. Calf refill is equal in less than 3 seconds. Next, we're going to move into some range of motion. I'll get you to flex and extend your elbows for me. Right. Turn your forearms in and out. Alright, I'm going to get you to flex and extend your elbows again, but this time against resistance. So pull in and push out. Alright, I'm going to get you to flex and extend your wrists. Good. Get you to make a fist. Next we're going to open and close our fingers. And then we're going to touch our thumb to each finger. Alright. Next we're going to get you to hold your arms out to each side. I'm going to get you to come in and touch your nose with one of your fingers, slowly becoming quicker. Alright, perfect. Next we're going to check for graphesthesia and stenosis. So I'm going to have you close your eyes and hold out your palms. I'm going to place an object in one of your hands. I'm going to tell me what it is, okay? A key. Alright, it is a key. And the other hand.
A quarter.
It is a quarter. Alright, good. Have you keep your eyes closed. I'm going to take one of your hands and write a number in your palm, okay? And I want you to tell me what number I'm writing.
7.
Okay. The other hand.
3.
Okay. And it was a 7 and a 3. Next, we're going to go ahead and move on to check our reflexes. We'll begin with the triceps reflex. I'll try and get around here. Just relax your arm on mine. There you go. Okay. And the other side. Both tricep reflexes are equal on both sides. Next we'll move into the brachial. So just relax your arm right there for me. Alright, and this side. Alright. Brachial reflexes are equal on both sides as well. And we will go ahead and move into the radial. And radial reflexes are equal bilaterally as well. Next, we're going to move into our anterior chest. I'm going to get you to lay down on your back for me with your head on this side. I'm just going to begin with inspection and palpation, like everything else. Inspect her chest for any sort of deformities. Nothing noted there. Chest looks to be symmetrical. Feel for any sub-Q air, which I don't feel any. Work of breathing is good. There's no difficulty of breathing. Next, we're going to palpate her pericardium for PMI, any pulsations, any thrills. I don't see any visible pulsations. I do feel her PMI, but I don't really feel any other thrills or anything like that. Next, we're going to auscultate her heart sounds with the diaphragm first. Start with the aorta. And then the pulmonic. And then the mitral. And the tricuspid. Alright. S1 and S2 noted, no gallops or any other heart sounds noted. You can go ahead and listen to the same areas again with the belt. Listen for any bruise. And the mitral. And the tricuspid. And again, I don't hear any bruise. Next, we're going to move on to our abdomen. Begin with inspecting and inspecting our abdomen. Abdomen seems to be symmetrical. Umbilicus is midline. No hernias or anything like that noted. No visible pulsations. Next, we will go ahead and move into listening to bowel sounds. Alright, bowel sounds are active and normal on both sides, in all quadrants. Go ahead and listen to her renal and aortic arteries. Renal artery and aorta. And I don't really hear anything there, so that's not out of the norm. Next, I'm going to go ahead and percuss all four quadrants. Just kind of listen for any differentiating sounds. Any pain whenever I do this? Alright, and now we're going to go ahead and palpate, beginning with light palpation. You let me know if any of this hurts. Any pain with the touch? No. Alright, go a little bit deeper and let me know again if there's any pain. No pain? No. Alright, go ahead and try to palpate her liver. Real deep. Alright, I'm unable to feel her liver, which is normal. Alright, let's go ahead and check her lower extremities. Begin with inspection and palpation. Legs appear to be the same. No excessive hair growth. No edema noted. Go ahead and feel for pulses. So I'm going to get you to bend your knee up a little bit for me. Feel for the popliteal pulse. And on the side. She's got good equal popliteal pulses. Go ahead and move down to the posterior tibial. Again, good equal pulses. And check dorsalis pedis. And again, 2 plus equal pulses bilaterally there. Next, I'm going to go ahead and get you to raise one leg up at a time, 90 degrees. All right. I'm going to get you to bring your knees to your chest for me. All right, perfect. I'm going to get you with one leg at a time to move your leg out and then back in. And then with your knees bent, I'm going to get you to rotate your legs in and out. So knees out and then back in. Perfect. Also going to have you bring your toes up towards you and press your feet down like you're driving a car. I'll do that again, but with resistance this time. So pull up. All right, and push down. Perfect. Got shoes strong on both sides, equal on both sides. Make it you go ahead and turn your feet in and out for me. Perfect. Next, I'm going to get you to take the heel of one of your feet and rub it down the shin of your opposing leg. And the other side. Perfect. All right. Let's go ahead and, while we're still laying down, go ahead and do our Babinski reflex. Hold your foot up. All right. And this one. All right. Babinski reflex is normal. Her toes did not fan out. All right, let's go ahead and have you sit up for me with your legs off the bed. Go ahead and check our Achilles reflex and our patellar reflex. All right, good reflexes there, equal on both sides. And now for the Achilles, just gonna hold your foot here. All right, and this side. All right. Equal reactions on both sides of the Achilles. Both her feet tended to go down whenever I struck her Achilles. Next, we are going to have you stand up. And I'm going to get you to walk on your heels that way for me and come back walking on your toes. Check for motor function and strength. Get you to jump on one leg for me. And the other leg. Alright, I want you to just stand real still with your arms by your side. Do the Romberg test. See if there's any swing or any instability. And close your eyes for me. And still no extreme swing or anything noted. I'm going to go ahead and check your spine. Inspect and palpate that. Spine seems to be midline, no deviations or anything. Any pain when I press against here?
No.
Okay, no pain. And last but not least, just going to do a few range of motion exercises. I'm going to get you to bend forward and touch your toes for me. Alright, and stand up and lean back. Alright, and lean side to side for me. Alright, and turn your shoulders to each side. Alright, I think that's about it. Everything looks good. No real abnormalities noted. Thank you so much.
Thank